I'd like to welcome everybody to today's presentation on monitoring progress and overcoming barriers to achieving your goals. I'm your host, Dr. Dawn-Elise Snipes. Today, we are going to be reviewing the goal setting process just real quick. Identify tools for monitoring progress, identify obstacles for goal attainment, and explore methods for identifying and addressing obstacles to goal attainment. So while I'm getting started, I want you to think about some goals that you regularly set with your clients or for yourself, whatever works for you, so we can actually try to apply what we're talking about today. So the goal setting process, we've gone over this in a bunch of other videos, but for those of you who this is your first time, the goal setting process is called SMART. Specific. We want to set goals that are very specific, not something broad like I want to feel better. We want to set specific goals such as I will be able to stay awake for at least 16 hours a day. Measurable in frequency, intensity, and duration. And this is what we're going to talk about a lot today, because it's hard to know if you're making progress if you don't have a yardstick to measure yourself against. If you say, well, I want to improve my mood. Wonderful. What is your mood now? And what do you want it to be? How are you going to know when your mood is improving? We need to make sure it's something that's achievable. Don't set yourself or your clients up for failure when you set goals. Make sure that whatever we're asking them or ourselves to do is realistic and achievable within that time period. For example, somebody who is just getting into detox, they are not going to feel very good and they're going to have trouble concentrating for at least a month or two. They're going to be coming out of that brain fog. So expecting them to be, cleared out and 100% on in 4 days when they finish with the acute detox, that's not achievable. That's not even reasonable. Relevant. We want to have people reflect. Will achieving this goal help them move towards something important in their rich and meaningful life? I have people that I've worked with, and the most common example we give is somebody who comes into therapy and decides that their relationship's a mess, and they think, well, if I can just get in better shape and lose some weight, my relationship will magically improve. It's nice to think maybe that there's something that easy, but generally there's a lot more to it. So stepping back and saying, in what way is this goal actually keeping me, or this problem actually keeping me from achieving my goal? And what are some other things that I might be able to do to achieve my goal? And then time limited. When we work in behavior modification, we recognize that there's something called behavior strain. If you start doing a behavior and it's hard, change causes crisis, crisis causes change. Any kind of change takes energy and effort and can be uncomfortable. So we need to make sure, especially in the early stages, that their behaviors are being rewarded frequently. I tell people a lot of times in very early stages of change, reward yourself based on something you can do in an hour or in a couple of hours. And then what can you do in a day? What do you want to get done within a week? What do you think you can get done within a month? And those goals may have to be modified some, but it's important to have those baby steps in there. And again, I'm going to go into much more detail with examples in a minute. Progress is often a combination of improvement in the frequency, intensity, and duration of a behavior or an issue. Now, we can talk about increasing positive behaviors or decreasing unwanted behaviors, however you want to focus on it. But the frequency is how often does it happen? The intensity is how hard or how intense was the problem. And the duration, how long did it last? Frequency, intensity, and duration all use energy. If I go to the gym twice a day, every day, and when I was in high school, we'd have that week right before the season started where we would have 2-a-day training to get us in shape. That was freaking exhausting. So frequency uses energy. Even if you're not, giving it 1,000%, it still requires energy. Or you can go to the gym less frequently and work out super intensely. You're still going to probably exert a similar amount of energy. Or duration. If you go for a longer period of time, maybe I go to the gym 2 days a week for 3 hours at a time, as opposed to 5 days a week for 30 minutes. They're still using about the same amount of energy. So we need to recognize that when people are crying, if they're crying 15 times a day, but it's not super intense, that's going to take energy. It's going to take a lot of energy. If they are only crying twice a day, but they are just bawling their eyes out, it's going to take as much energy. If they are crying a couple of times a day, but it's, for hours, not just this burst, that too is exhausting. So improvement comes in looking at all the frequency, intensity, and duration. And progress will fluctuate between frequency, intensity, and duration. And when there is a change, we need to explore what was different the day before or that day in each piece of life. What caused that change? Whether it got worse or it got better. We want to know both. If it got better, let's do more of that. If it got worse, okay, let's figure out what did we miss? What happened? In terms of measuring, frequency is pretty straightforward. It's how many episodes did you have per day, or how many symptomatic days did you have per week? Some things like sleeping. If you have insomnia, you're going to want to identify how many days a week you got more than 6 hours of sleep, for example. Intensity can be measured a variety of different ways. The Likert scale is what we typically use. And it's important when you're using a Likert scale, that's the 1 to 5 scale, or 1 to 4 scale, that you provide verbal anchors. Because how are you feeling today on a scale of 1 to 4? Well, what's a 1, what's a 4, and what's everything in between? So giving people verbal anchors helps them be more accurate, so you have better retest reliability, if you will. What I like to use on my Likert scale, I use a 4-point Likert scale. Why do I do that? Because research has shown that when you use an odd number Likert scale, especially a 5-point Likert scale, people tend to default to a 3. They default to the middle. It's fine. And we want them to really think a little bit more than just go with default. So I use none, some, a fair amount, or hard to manage. Or none, some, a fair amount, and I knocked it out of the park if we're looking at a behavior we want to increase. Not everybody loves numbers, so you can have people use a gauge, on the knob. When you turned your knob, did it go to a 1, a 2, a 3, or a 4? Again, we're anchoring it with words. Some people like using a gauge, like a thermometer sort of thing. And they may even just shade in the thermometer. How intense was it for you today? And then you can compare those things. Now, the thermometer example is a little bit harder to ensure that you're getting good retest reliability. So what they fill in as 75% full today, they may only fill in as 65% full tomorrow. Did they do worse, or are they just having a different determination on how much they should fill in? So again, I really like the Likert scales. They are relatively quantifiable. In terms of intensity, you can also look at things like calories eaten if you are helping people reduce the intensity of their binges, or the number of drinks consumed if you're helping people reduce that, number of cigarettes smoked. If they're at the gym and they're trying to get stronger, we can measure intensity by the amount of weight lifted. Frequency would be how many times did you go to the gym, or how many sets did you do? Intensity would be what's the weight that was lifted. And then duration is the time spent per episode measured in minutes, hours, or days. And I know that's all pretty abstract. So let's talk about it. Tantrums. When we monitor progress, I encourage people to track their frequency, intensity, and duration, but we've got to be able to define that. So I just created a generic table down here that we're going to apply to each of these. If you're trying to help somebody reduce their tantrums, the baseline for this particular person was 10 times a day. Well, that's pretty high. The intensity of those tantrums was an 8 out of 10. That's pretty high. And the duration of each tantrum was about 30 minutes. Wow. Okay. So it was really taking a lot of time, energy. So that's where we're starting. That's our baseline. We need to know our baseline to know if we're making progress. And this is not 100%, it's not at all transferable in terms of you're not going to expect somebody to come in and do their assessment, and the very next day they're going to show dramatic improvements. But I was just kind of trying to pull this together for you. So the next time you look at their chart, on Monday, they had 6 temper tantrums, which is much better. That's an improvement in the frequency. The intensity stayed the same and the duration stayed the same, but they still are doing it less frequently. That's awesome. Tuesday, they backslid a little bit on the frequency. They had 8 episodes. So the question would be, what was different on Tuesday than on Monday? The intensity was a 6, though. So they had 8 episodes, but they weren't nearly as intense. This indicates to me, my brain starts thinking, well, maybe they are developing some of those downregulation skills. And that's awesome. The duration is still 30 minutes. And then on Wednesday, we start going back down again. It's a frequency of 7. The intensity went up a little bit more, and the duration cut down to 15 minutes. Well, that's awesome. So now we see that this person who's having tantrums is potentially developing the skills to downregulate more quickly. Now, there's still something going on that's causing these fluctuations, but we want to monitor those and we want to ask questions. We want to encourage them to use backward chaining and think, on the day that I only had 6 temper tantrums, what was different? Did I get more sleep? Did I make sure that my blood sugar was stable? Was I in less pain? What was different? Was I in a different environment? Maybe the person doesn't do well in the environment that they were in on Monday, or they do well in the environment they were in on Monday, but they don't do well in the environment they were in on Tuesday. So we need to look at each piece of life, physical, interpersonal, emotional, cognitive, and environmental, to figure out what was different. What was different that helped improve, and what was different that made it worse. Grief bursts. This is something that we go through, guess what, when we're grieving. And they can happen for months or for some people even years after the loss. However, we want to see a reduction in the frequency and intensity. When my parents died, the first, month or more, first month or so, it was intense. And I would have these grief bursts 4 or 5 times a day, and they felt kind of overwhelming. They weren't long. They didn't last 30 minutes, but it was just powerful and it was exhausting. And as I got further away from their death, my grief bursts started reducing in frequency and reducing in intensity and duration. And that's what we really want to look at. So how long is this episode where you're just crying and inconsolable? How long is it lasting? And are you getting to the point, a few months into it, I was to the point where instead of being crying and being inconsolable, I would get a little teary-eyed and weepy. But I would recognize that, I'd have compassion for myself, and I would take the next steps in order to re-regulate. Binge eating. How often do you do it? How intense? How many calories do you eat when you are binge eating? That's easier to quantify than how much, but you can quantify how much, like how many boxes of Oreos did you eat? Or how many cartons of ice cream did you eat? When we're talking about a binge, we're talking about a significant number of calories. But we want to see that reduce. We want to see the person start developing the skills that they recognize, hey, this isn't what I want to do, and I need to change up. I need to try something different. Gambling. How often are you doing it? And this can be online gambling. This can be trading, stocks, or even crypto. Even bingo for some people can be a gambling thing. I remember when I used to go to bingo with my grandma, these women were serious about it. They would have 8 cards and they would be ready to go because there was a prize. There were things to win, and they were serious about it. But ultimately, for some people, that can become an escape, and it can become problematic. So if they are gambling 10 times a day, especially now that you can gamble on your mobile device, oh my gosh, and you can even play bingo with money on the mobile device. Who knew? But that can actually become really problematic really quickly for people. How intensely are you doing it? Which basically means how much money are you spending or how much are you wagering on any one game? If you're wagering 50 cents, that's far different than if you're wagering $50. And how long are you spending engaging in that gambling behavior each day? Now let's think about falls. If, y'all know I've been doing a lot more work with the older adults, and one of the issues that a lot of them have is falling. So we want to look at how frequently are they falling. Now, intensity and duration doesn't really play in here a lot, but we do. If they're falling more frequently, we want to ask ourselves, what's different? Is their blood sugar unstable? Are there hazards in the environment, etc.? Intrusive thoughts. How often do you have them? When you have them, how intense are they? Does it feel like somebody's screaming in your head and you can't think of anything else? Or it's just this minor annoyance like a fly in the room that you want to swat away? And the duration. When you start having these ruminations, how long do these rumination periods last? Is it 30 seconds or 30 minutes? And then identify what you want to get to. So ideally, with intrusive thoughts and ruminations, I want to have it happen less than once a week. I want it to be an intensity of no more than 2 out of 10. and I want it to last no more than 30 seconds. That's my ultimate goal. But if I'm struggling with ruminations 10 times a day at an intensity of 8 and they last for 30 minutes, my goal is way down the road. It's going to take a minute to learn the skills I need and for those skills to become strong enough and for me to become adept enough at using those skills in real life to turn it down that much. Now, I have a couple others because I did want to have positive stuff here. If you're working with a toddler and they're potty training, you can have the number of successful potties. How many times did they potty today? What was the intensity? And duration's probably not important, but that's important. When my son was in the NICU, you'd be amazed at how focused they are on excretions. And every time he'd go to the bathroom, we would have to weigh his little diaper, and they would make a log of it. And that was, so they were registering how frequently he was going to the bathroom, and intensity was how much output was there. For energy, people want to have energy. Go figure. So we can think about during the day, how many times during the day did you feel energized? And hopefully we're going to get that number up. The intensity of your energy. Was it, a 4? You weren't exhausted, but you weren't ready to go run a marathon? Or was it higher? The duration of your energy. You have these little energy bursts and they last 10 minutes? Or when you get your wind, you're good for 2 hours. And that's what we want to know. So what is your goal for your energy levels? If you want to improve your energy, what's that going to look like? Now, there are some things that you're not going to be able to measure on a minute or hour basis nearly as easily. Depression. Somebody is trying to improve their mood or overcome their depression. Great. So we want to start out by asking, how many days a week do you feel depressed most of the day? For the beginning, 7 days a week. Intensity, 9 out of 10. This person is really struggling, and it lasts all freaking day. And so you can feel for this person. They want to improve their mood. They want to feel better. They want to be relieved of their depression. So we want to look at, how many days a week were you depressed? And 7. Okay. What was the intensity? The intensity was a 7 out of 10. They've got hope that things may get better or something changed. And we need to inquire, did something change, or are you just hopeful that this is going to work? And how long did it last? All day. All right. So we're still not seeing major improvements, but it's a step or 3 forward. And that is fabulous. Now on Tuesday, they are still this next week, they're still experiencing depression 7 days a week, which, sucks. The intensity on this day was a 9 out of 10. Wow. Okay. What was going on there? But it only lasted all morning. So maybe you talk to the person and they say, well, on that day, I broke up with my boyfriend the night before. And when I woke up, it just hit me like a ton of bricks. But I went to work and I got started. And by the time I got to the afternoon, it was doing better. Well, fabulous. Awesome. Let's talk about pain. Chronic pain increases stress and inflammation and anxiety and irritability and all kinds of crap. And anxiety and stress and irritability increase pain. As clinicians, even if you're not a medical clinician, we need to recognize how pivotal addressing chronic pain is. So for somebody who has pain 7 days a week and it's a 9 out of 10 intensity and it lasts all day, That's excruciating. It's not a wonder they're probably in a bad mood and their blood sugar's all over the place. On Monday, or the next week, they are still experiencing pain 7 days a week. The intensity is somewhat lower, but it's still all day long. The next week, still have pain 7 days a week. It's back to a 9 out of 10. Ooh, what's going on with that? The other difference is it's only in the morning. Well, you start talking to the person and you realize that they started going to physical therapy every afternoon. And so when they get up in the morning, their joints and their muscles and everything else are still really sore. But once they get up and get moving and get things loosened up a little bit, the pain starts to go down again. In terms of cultivating success, we need to make sure we are helping people set achievable goals. Someone's episode of anxiety or depression is not going to go from an average of 8 out of 10 to 3 out of 10 in a week. We'd love to think it would. I'll just give you this tool, you can use it, and it'll change your life. That's just not realistic. We give people tools that may be life-changing, but that's not something that they're used to using. They're not super skilled, super adept at using it yet. So it's probably not as effective initially. It will become more effective as they practice. As they use it more, it'll become more second nature. But expecting somebody or setting them up to expect that their mood is going to improve that much in a week is not fair. Educate people about the different types of progress and celebrate improvements in frequency, intensity, or duration. It's important to help people recognize the different types of change that they're going through, because sometimes if grief, for example, if they're having these grief bursts, it feels like the grief will never end because the intensity of the grief bursts may be staying the same, but they're not as frequent, or vice versa. The frequency of the grief bursts is still the same, but they're not as intense anymore. They are a 3 on the scale as opposed to a 4. Helping them recognize it's progress. Yes, you're still having them just as frequently, but the intensity is declining, and that's good. That's good. That shows that you are headed in the right direction. And then exploring with them, what is it that you think is different that is helping you reduce the intensity of those grief bursts? Explore changes in frequency, intensity, and duration as a learning process. If they're going along and their grief is getting less frequent, less intense, things are going great, and then all of a sudden, bam, they have a really bad weekend. Okie dokie. Resurgence or relapse doesn't mean that they failed. It means something changed. There are a lot of triggers in the environment. My stepfather had trauma that revolved around Christmas. And as soon as the Christmas lights and decorations and stuff would come out in the store, his mood would change drastically. And it was hard for him to be around that. So eventually he quit going to the store so he didn't have to see it. But recognizing the trigger that is causing the resurgence of the distress is important. We want to use chaining to understand and modify the behavior. And chaining basically means looking backwards and saying, what changed? This led to this, which led to this, which led to this, and here we are. If the chain is good, they have a decrease in symptoms, then wonderful. What changed and what can we do more of? If the change is a regression in some way, we want to say, okay, let's look at what led up to this and what do you want to do less of, or what do you want to change? One person that I worked with that was in addiction recovery, whenever they would start dating, they would relapse. It was not a clock thing, but you could pretty much guarantee as soon as they got to the point in their recovery that they were going to try to start dating, they were going to be back in detox in short order. So using chaining, we helped them recognize this seems to be a big trigger for you. And then they were able to process that with their therapist and, work through it. They're in a great relationship now. It's fabulous. But they were not putting the connection together that dating triggered abandonment and rejection stuff and their wounded inner child, which triggered them to want to escape. We want to make sure that we are attending to relevance. Have the person answer the question, in what way will achieving this goal help me move toward my bigger goal of whatever it is? If you want to improve your relationship, if you want to improve your mood, if you want to be healthier, whatever that big goal is, it's important that we look at the steps we're taking toward it and make sure those steps are leading us toward our eventual endpoint and not just a diversion, not just something that we hope is going to work. An example, the big goal, I want to graduate college. The medium goal, got to pass this semester. So that's 16-week goal there. Okay. The smaller goals that the person needs to set, they're going to go to class 93% of the time. Why 93? Because that means they go to 15 out of 16 sessions. We don't want to set something so a person feels like in order to succeed, they have to be perfect. I always try to give a little bit of wiggle room, especially in the beginning. So go to class 93% of the time. Complete homework as scheduled 80% of the time. Now, you and the client may work together and decide, no, I really need to do my homework at least 95% of the time. Then, okay. If it's something like calculus that every lesson builds on itself, or if you're in a class where the professor is going to give you pop quizzes, then you probably need to make sure you're doing your homework more frequently. If it's something where you've got a midterm and a final and that's it, 80%, setting a goal for when you're going to get your assignments done and staying on task 80% of the time may be enough. And spend at least 3 hours studying at least 5 days a week. So what are you doing? How frequently are you doing it? 5 days a week, you're studying, and you're spending 3 hours doing it. So that's the duration. And this is something people can look at and say, yes, I did it, or no, I didn't. Did I go to class 93% of the time? Yes, I did. Throughout the semester, they can even have a board where they're marking off each time they go to class. And if they don't go to class, they circle it. Then they know they can't miss any more classes. Another example that's more counseling related. Heal my nervous system to reduce dysregulation episodes to less than 1 per month, a less than 3 in intensity, and it lasts for 30 minutes or less. And I want to do this within the next year. Okay, that's probably achievable. It is time limited. So I'm going to jump down to my small goals first. In order to accomplish this, I'm going to try to sleep at least 7 hours each night beginning today. Now, yes, I know I didn't give myself any wiggle room there. I said each night. You can talk with the person about what they want to do. But ultimately, we know the impact of sleep deprivation on people's mental health and their ability to regulate, because sleep deprivation triggers the stress response. So sleep needs to be one of those important things. I want to get blood work done within 2 weeks. That's a yes, I did it, or a no, I didn't. I want to learn the ABCDs of distress tolerance, and I want to learn it today. I want to learn it in session before I go home. What are the ABCDs? Accept what's going on. It is what it is. Breathe. Slow your breathing to help activate the vagus nerve and trigger the relaxation response. C is compassion. Have compassion for myself instead of getting angry with myself because I'm dysregulating or angry at this or angry at that. Have compassion. I'm doing the best I can right now. D stands for distract. All right, I've slowed my breathing. I'm having compassion for myself. Now I need to turn my attention to something else for a minute until my nervous system resets. And then S stands for support. Some people, instead of distracting, would prefer to seek support. Whatever works for you. But ABCDs of distress tolerance. And I'm going to give that to my client in a handout. So they have it that they can look at. They're going to practice using the ABCDs at least once per day, beginning tomorrow. All right, so I just learned this skill. I'm going to practice using it. Well, what if I don't have any dysregulation episodes tomorrow? All right, that's great. Maybe you're further along than you thought you were, but likely they will. Will they remember to use the ABCDs when they're dysregulating? Probably not. And it's important to help people understand that when they are in fight or flight, when their stress response is triggered, their executive functioning and planning and all that stuff, it unhooks. The brain is more concerned with survival than thinking. So something that is not second nature is likely not going to be something that you're going to automatically remember as soon as you learn it. So if they are going to start practicing the ABCDs, a lot of times what I have people do is I have them look back over the day and identify one time they dysregulated and think, if they would have remembered to use it, how could they have accepted it is what it is? What would they have done to slow their breathing? How could they have shown themselves compassion? And what would they have done to either distract or seek support? And have them envision themselves doing that now. So see themselves actually reacting differently to this situation. It actually does, believe it or not, help train the brain to start doing that. Athletes will envision themselves doing things in order to improve their skills, whether it's their dive or their golf swing or their tennis swing or whatever, throwing a football. They envision themselves doing it. They envision themselves throwing the ball and it connecting with the receiver. It actually does help strengthen those mental connections. And have people keep a daily log of their progress at least 6 days a week to share with their therapist. So frequency, intensity, and duration, or whatever you're measuring, of some target behaviors, as well as the big one. So for this person, they are trying to reduce their dysregulation frequency, intensity, and duration. So that's what I'm going to want to see. Over the last week, how many times per day did you dysregulate? How intense was it on average? And how long did it last on average? Now, going back up to the medium goals, your small goals are the ones that you're going to do in a very short period of time. And so the person can do them and say, I did that. If I slept 7 hours last night, I can get up and I can say, I did that. If I went and actually got my blood work done, I can mark that off and say, I did that. That's a success. That's going to increase dopamine. That's going to increase self-efficacy. And that's going to help them engage in the process and be more committed to it. Because as they say, they've kind of got skin in the game. If they're actually putting effort into it, then they're more likely to continue to engage in it. So the medium goals, remember, we want to make sure that the goals are achievable. So ultimately, the person wants to reduce dysregulation episodes to less than 1 per day, a less than 6 in intensity, and less than 60 minutes in duration by 90 days. Okay, that might be possible. And I'd really need to talk with the person about how long has this been going on. Think about what it's related to. If they've got an extreme trauma history, 90 days may be a little fast. But I also don't want them feeling like it's a never-ending process. The other medium goal, use the ABCDs of distress tolerance at least 75% of the time when I dysregulate by 90 days. So encouraging the person to think that by 3 months from now, 75% of the time, or 3 out of every 4 times that I dysregulate, I will remember to use the ABCDs. And those are medium goals. That's not going to happen overnight. It's a medium goal. We definitely want to work with our clients to ensure that they have frequent successes in early recovery. Well, preferably all the time. And I talked about behavior strain earlier. And that's the point at which the effort outweighs the reward. If there isn't a reward coming soon enough, then the person's motivation is going to dwindle. So the effort needs to be on par, so to speak, with the reward. So a little goal, a little effort with a little reward is wonderful. If you have something that's longer, when children are very little, a lot of times we have star charts and things. And oh my gosh, a star, so awesome. When we get to be older, we can delay gratification a little longer. So we don't need the stars, but we want what's coming at the end of the week, like our paycheck. So my boss doesn't have to give me a star for showing up every day, but he darn sure better give me my paycheck. And we need to understand the difference for things that are hard, even for adults, for things that require a lot of effort. We want to make sure that the reward for that behavior is adequate. And that means what they define as rewarding. If I think that going to a movie is super rewarding, but my client doesn't, then if I say, well, if you do this all week, then you can go to a movie, they're going to be like, yeah, so what? So we do need to make sure that they identify what's rewarding for them and recognize the need to match the intensity of the behavior, the intensity of the effort to the intensity of the reward as much as possible. Regular mindful check-ins also come in very handy to help people catch small changes and notice their vulnerabilities. When people have been doing something for a while, they may not notice when they're becoming more vulnerable, when they're being triggered, until it's there. They may also not notice small improvements in their behavior, in their mood, etc. Think about if you've ever gone on a diet. I think most of us have. Or you had a puppy at home and you were watching it grow up. You see that puppy every day, or you see yourself in the mirror every day, and you may not notice every day, hey, I lost a quarter pound, look at all this change. And with the puppy, you're not going to notice that it grew an ounce over the past day. But every once in a while, you're going to look down and you're going to be like, oh, you're not a puppy anymore. You made a lot of changes. Same thing with losing weight. You're going along, doing your thing, losing, a few ounces every day. One day you're going to put on your jeans and they're going to be super easy to button. And you're like, whoa, when did that happen? Same thing can happen with our mood in the positive direction as well as in the negative direction. People can go through life, putting one foot in front of the other until they get so burned out they can't see straight, but they didn't recognize it until they were so burned out they couldn't see straight. Likewise, People in recovery from depression, for example, or anxiety may have small improvements, reductions in intensity of their episodes or the frequency of their episodes, but they're still having them. So they're not noticing that the frequency and the intensity has gone down or the duration has gone down. Encouraging people to regularly, throughout the day, I encourage them at every meal, breakfast, lunch, and dinner at the very least, check in with yourself and see where you are in terms of how you're feeling about things and your progress toward meeting your goal. It's also a great time to rehearse skills like the ABCDs. Obstacles to progress, skill deficits, or they're not able to translate skills to practice. It can be really difficult to take some of these abstract concepts and actually apply them. One of the big things for a lot of people is that place between when they get distressed and when they react. There's a little tiny break in there that's like a millisecond that they must make the decision on how they're going to react. Are they going to stop and engage their new skills, which, takes some effort, or are they going to just be on autopilot? And it's hard. It is hard to remind yourself, which is one of the reasons that the retrospective review, the reflection on, let me think about one of the times I dysregulated today. What happened? What could I have done in that situation to help myself stop and remember to use the ABCDs? That's probably one of the biggest hurdles. But there are others. If you are trying to overcome social anxiety and you have difficulty talking to people, it's really hard to rehearse by yourself talking to people. And so rehearsing in session or with friends or family members, one or two people that you can trust to rehearse with you. The retrospective review, like I mentioned. And then scaffolding. Where are you getting stuck? If the person is having difficulty translating the skills to practice, at what point are you getting frustrated or lost? Maybe they recognize they have the ABCDs, they've been rehearsing it, they know how well it works, and they stop and they accept, and they can't move past the breathing. They can't get to the point where they're actually down regulating. All right, let's talk about how to remember what comes next. What can you do? Square breathing isn't for everybody. And if it's something that they're not finding rewarding, then they're probably not going to do it. My adult clients, I encourage them to keep bubble gum with them. That's a great thing to do because bubble gum tastes good, number one, so that's rewarding. But when they chew the bubble gum and they blow a bubble, they're slowing their breathing and triggering that relaxation response. Sometimes people start to dysregulate, something's really triggering them, and they recognize they don't want to do it, but they don't feel like where they're at right then, they can start their breathing and everything else they need to do. Okay, so when that happens, what can you do to put yourself in a different situation? The bathroom is a great place. If you're at work, there's always a bathroom. If you're at school, there's always a bathroom. So excusing yourself and going to the bathroom for a minute can be a step that the person takes before they start slowing their breathing and engaging in those things. If I'm sitting in a meeting at work and I start to get triggered, I'm not going to pop bubblegum in my mouth and start blowing bubbles. That'd be rude. However, I may excuse myself, go to the bathroom, and pop some bubblegum in my mouth. So helping people identify what is keeping you from being able to successfully implement this. Sometimes it may be that they're not understanding the skill completely, like the breathing. They start doing this deep breathing like you do when the doctor's listening to your heart. And it's almost like they're breathing with big breaths, but they're hyperventilating. No, that's not what we want to do. So helping them understand the tool and become more skilled at using the tool can be important. They may have a lack of self-efficacy, belief that they can do it, or a lack of belief in the process. So we want to monitor progress. As they have improvements, we want to note the improvements. If they have a relapse or a resurgence, okie dokie. Well, that's unfortunate. And, we can talk about your frustration and everything else. It's also important to look at what you've been doing right and the progress that you've made. And sometimes it is 3 steps forward and 2 steps back, but you only went back 2 steps. Think about the skills you have now that you didn't have before. Think about the abilities that you have and the strength that you've shown as you've learned those new skills. We want to ensure the client that we're working with our willingness to assess and adapt. I am going to walk this walk with you. So if you are having difficulty in this process, if you're having difficulty implementing a tool or achieving your goal, we are going to regularly assess. And the treatment plan or the approaches we're taking may need to change a little bit to be individualized to you. But I'm here to be your support in this process. Become mindful of and address vulnerabilities. Remember, vulnerabilities activate the stress response. They put you in fight or flee and unhook or deactivate, if you will, the thinking mind. When people are vulnerable, if they are physically sleep deprived, in pain, sick, hungry, hormone imbalances, that's going to likely make them more vulnerable, which means their stress response is more likely to be more sensitive that day. Interpersonally, your self-esteem, your sense of efficacy in what you're doing and where you are, being around toxic people, or even transference. If you're around somebody that reminds you of a bad person from your past, then it can trigger the stress response. You feel vulnerable. You know it's not the same person, but they sound just like them or they look just like them. And it triggers those memories. Now, we can deal with all of that, but it's important to recognize that when you're interacting with that person, you may be more vulnerable to distress. Emotions, distressful and happy emotions. And I know you're going, happy? Yeah. Well, obviously, if you're angry, anxious, depressed, grieving, guilty, all of those distressful emotions is triggering your stress response. So you're probably going to be more likely to be at that point where it's just going to take one straw to break the camel's back. But happy, yes, happiness can actually be an obstacle to progress because people get too happy. They think, oh, things are going well, and they quit being mindful. They quit paying attention. In addiction recovery, we call this the pink cloud. This is an early stage of recovery, a couple months in, and people start feeling like, I don't have the desire to use anymore. I'm getting my energy back. I've got this thing licked. And if they coast on that pink cloud and don't pay attention to their vulnerabilities and their triggers and doing the next right thing, before you know it, that addiction's going to bite them in the butt. Cognitions can be vulnerabilities if you are having unhelpful thoughts. If you've just got brain fog, you can't think clearly, you can't concentrate. Your brain recognizes that puts you at makes you more vulnerable because you're not able to process information and defend yourself as quickly. Or if you're just overwhelmed, when you're overwhelmed, that's a stress response, which means, guess what? Other things are going to feel 2, 3, 10 times more impactful or overwhelming than they may have in the past. And environmental triggers, smells, temperatures. For me, oh my gosh, I can tell you, if I'm hot, I am, well, we'll just call it hangry. I know we usually associate that with hungry, but when I get hot, I get cranky as can be. And yeah, so menopause was quite the adventure for my family. Let's talk about applying it. And I know we've only got a couple more minutes. Sally's been maintaining a mood of 7 out of 10 at least 6 days per week for the past 6 months. That's pretty good. A mood of 7 out of 10. I like it. This week, her mood plummeted to a 4 out of 10. What might have caused it? And this is where we don't want to say, you've relapsed. You're all the way back at the beginning. No. Think about it as if you're climbing a mountain, but you've got a harness on. You've got rappelling gear on. So you're starting at the bottom and you're climbing up and you lose your footing and you slide back down. Yeah, it sucks. You got to climb back up the mountain again, but you're not going to fall all the way to the bottom. And you've got help from your friends or the anchors you put in along the way to climb back up the mountain. Chris's dysregulation episodes had decreased to less than 1 a month, an intensity of 4, and lasting less than 30 minutes. The week before state testing, they increased to 3 times a day with a 5 in intensity, lasting about 30 minutes. State testing, when I was working in the schools, was one of the most heart-wrenching times of year for these children. I mean, for me to even be in there. I had some students who were so worried about their state testing, in Florida, they call it the FCAT, that they literally would pull out their eyebrow hairs. They got so stressed about it. I had some others that would start picking incessantly at themselves because of the stress. So maybe Chris is experiencing distress as a result of it getting closer to that time to do state testing. So that's obviously going to become a treatment goal. And we recognize that Chris has these great skills. But what changed? This new stressor was added. So we need to help Chris identify and recognize you haven't gone backwards. Something new just got piled on. So let's help you figure out how to keep going. Julie's pain fluctuates between a 4 and a 10 and a 9 of a 10 intensity. The 9 and 10 only lasts for the first few hours of the day. And I kind of gave this one away earlier. For some people, the going to physical therapy in the afternoon or even in the morning, and then they're busy all day long, and then they sleep at night. They're not moving a lot. They wake up in the morning, and it's like, oh my goodness. We want to recognize what's going on. We also want to explore, maybe Julie's not in physical therapy. Maybe she's got a really crappy mattress or the wrong kind of pillow for the way she sleeps. Sleep ergonomics is huge in preventing pain because you're spending 7, 8, 10 hours and you need to have your spine supported and in alignment. People often set goals that are too big, too hard, too vague, or just plumb irrelevant, which leads them to feel defeated. Help them recognize and celebrate the different types of progress, frequency, intensity, and duration. Use chaining to explore behaviors or vulnerabilities that led to an increase or decrease in their target symptoms and or changes in the frequency, intensity, and duration. And help them figure out ways to modify behaviors and environments to empower them for success. If this environment is increasing your stress level, if this mattress is increasing your pain, well, let's figure out how to fix it. Are there any questions? I'm glad you enjoyed the lecture, Lisa. That's very common, my pal Sal. I saw it so frequently. You are quite welcome, as always, Jason and Janine. You're welcome, Jennifer. Glad you enjoyed it, Catherine and Gina. Okie dokie, everybody. Have a wonderful, absolutely fabulous rest of your week. And I will see you next Wednesday. Same bat time, same bat station.